I can prove this to you. And it's not a question of morality, it's a question of health. After more than 30 years working with men in their later years, I've seen patterns that most doctors won't discuss openly. Today, I'm going to share something that could quite literally add years to your life. And I mean that in the most clinical sense possible. My name is Dr. Sophie Caldwell, and I've spent over 3 decades in men's health, specializing in urological care for gentlemen over 60. I've worked across the NHS and private practice here in the UK, from Manchester to Cornwall, and I've had conversations that many men find uncomfortable, but are absolutely essential. This isn't about embarrassment. This is about your well-being, your quality of life, and frankly, your longevity. Now, I know what you're thinking. Dr. Caldwell, surely at my age these matters aren't as important. Let me tell you something I've observed time and again in my consulting room. When men stop paying attention to their intimate health, everything else starts to decline. And I mean everything. Your cardiovascular health, your mental well-being, your hormone levels, even your posture and confidence. Think of it this way. You wouldn't stop brushing your teeth just because you've hit 60, would you? You wouldn't stop taking walks because you're retired. Your intimate health is exactly the same. It requires maintenance, attention, and yes, regular activity. What happens when you stop using any part of your body? It deteriorates, your muscles atrophy, your joints stiffen. And the same principle applies to your intimate health. I've had a patient, lovely chap from Bristol, came to see me at 72. He'd been widowed for 5 years and had completely given up on that aspect of his life. He thought it was over, done with. But he was experiencing issues, urinary problems, difficulty sleeping, low mood, back pain. He couldn't connect the dots. It took us 3 sessions before he admitted he'd simply stopped all intimate activity. And I don't just mean with a partner, I mean completely shut down that entire system. The human body is remarkable, but it operates on a use it or lose it principle. When blood flow decreases to any area consistently, problems arise. In men particularly, regular blood flow to the pelvic region is crucial for maintaining tissue health, preventing problems with the prostate, maintaining erectile function, and even supporting bladder control. It's not just about pleasure, though, that matters too. It's about physiological maintenance. Let me be absolutely clear about something. Self-stimulation isn't a substitute for intimacy with a partner, if that's what you want. But for many men over 60, whether you're single, widowed, or your partner isn't interested or able, maintaining your sexual health independently is not only acceptable, it's medically beneficial. And I can back this up with decades of clinical evidence and personal observation. Here's what I've learned. Many of my patients have never had an honest conversation about this topic, not even with their GPs. There's still this Victorian hangover in British culture where we simply don't discuss these matters. But gentlemen, we're in the 21st century. Your sexual health is part of your overall health, full stop. Now, let me share 7 secrets that I've learned over 30 years. These aren't things you'll find in most medical textbooks, because they're based on real conversations with real men who've navigated their 60s, 70s, and beyond, whilst maintaining their vitality. The first secret is this. Regular ejaculation, regardless of how it's achieved, is linked to better prostate health. There have been studies showing that men who ejaculate more frequently have a lower risk of prostate cancer. We're not talking about excessive behavior. We're talking about maintaining a regular pattern. Think of it as clearing out the pipes. The prostate produces fluid constantly, and regular release helps prevent buildup and potential issues. I had a patient from Leeds who was diagnosed with an enlarged prostate at 65. His urologist suggested several interventions, but also mentioned maintaining regular sexual activity. This chap was single and hadn't been with anyone in years. He was embarrassed to ask what regular activity meant if you don't have a partner. When he finally asked me, I was direct. I told him that self-stimulation serves the same physiological purpose. 2 years later, his symptoms had stabilized. Did the self-stimulation cure his enlarged prostate? No, but it certainly didn't hurt, and it may well have slowed the progression. The second secret involves something called pelvic floor exercises, but not the way you might think. Most men have heard of Kegel exercises for women, but fewer realize that men have pelvic floor muscles too, and they're just as important. These muscles support bladder control, bowel function, and sexual function. When you achieve orgasm, these muscles contract rhythmically. That contraction is exercise. It's maintaining muscle tone in a way that simply doing Kegels alone cannot replicate. I've seen men in their 70s who maintain better bladder control than men in their 50s. And often the difference comes down to maintaining regular sexual activity, whether with a partner or alone. The rhythmic contractions during orgasm provide a workout for these muscles that conscious Kegel exercises simply cannot match in intensity or effectiveness. The third secret is about hormone balance. Your body produces testosterone throughout your life, though levels do decline with age. But here's something fascinating. Sexual activity, including self-stimulation, can help maintain testosterone levels. It's a feedback loop. Sexual activity signals to your body that these hormones are still needed, so production continues. When you completely cease all sexual activity, your body gets the message that these hormones aren't required anymore, and production can drop even further. I've had patients who complained of low energy, poor mood, difficulty concentrating, and when we checked their testosterone levels, they were indeed low. Some of these men were candidates for hormone replacement therapy, but before jumping to that, I'd ask about their sexual activity. More often than not, they'd stopped completely. After resuming regular activity, even if it was just self-stimulation, some showed improvement in both hormone levels and symptoms. Now, here's the fourth secret, and this one surprises many of my patients. The quality matters more than the quantity. I've seen men who approach self-stimulation the way they might approach any other task. Quick, efficient, job done. But that approach actually misses most of the health benefits. The real benefits come from extended arousal, increased blood flow over a sustained period, and the full hormonal cascade that comes with genuine arousal rather than mechanical release. Think about it this way. If you were trying to exercise your heart, you wouldn't just do a single sprint, would you? You'd do sustained cardio. The same principle applies here. Extended arousal brings sustained blood flow to the entire pelvic region. This nourishes tissues, maintains nerve sensitivity, and keeps everything functioning properly. A quick release might feel efficient, but it's missing most of the therapeutic benefit. I had a patient from Cardiff who'd been experiencing erectile difficulties. He could still achieve erection, but it wasn't as firm as it used to be, and it didn't last as long. We talked about various medical interventions, but I also asked him about his approach to self-stimulation. Turns out he'd got into a pattern of very quick, almost perfunctory sessions. I suggested he try extending the experience, taking his time, really focusing on arousal rather than just completion. 3 months later, he reported significant improvement. The sustained blood flow during these longer sessions had actually improved his erectile function. The fifth secret concerns lubrication. Gentlemen, I cannot stress this enough. Dry friction causes damage. I've seen men develop reduced sensitivity, micro tears in the tissue, and even conditions like Peyronie's disease, partly because of years of rough, dry stimulation. Your skin down there is delicate, more so as you age. Using proper lubrication isn't optional, it's essential. Water-based lubricants are best, they're safe, they don't cause irritation, and they don't damage condoms if you're also sexually active with a partner. I've had patients come to me with loss of sensation, And when we investigated, the issue was literally decades of rough handling without lubrication. The tissue had thickened in response to chronic irritation, reducing sensitivity. It's like how your hands develop calluses from rough work. You don't want calloused intimate tissue. Prevention is so much easier than treatment. The sixth secret is about variety and exploration. Many men get into a routine and never deviate from it. Same position, same technique, same mental imagery. But here's the thing. Your body responds to novelty. Trying different techniques, different rhythms, different levels of pressure can help maintain sensitivity and prevent that adaptation where you need increasingly intense stimulation to achieve the same result. I've observed that men who vary their approach tend to maintain better function into their later years. It's about keeping the neural pathways active and responsive. If you always stimulate in exactly the same way, your nervous system adapts and becomes less responsive. It's the same principle as why you'd vary your exercise routine rather than doing the exact same workout every single day. The seventh and final secret is perhaps the most important. This isn't just physical maintenance. The psychological and emotional benefits are enormous. Regular orgasms release endorphins, reduce stress hormones, improve sleep quality, and boost mood. I've seen men pull themselves out of mild depression, partly by maintaining their sexual health. The act of taking time for self-pleasure sends a message to your brain that you still matter, that pleasure is still important, that you're still vital and alive. I had a patient who'd lost his wife after 50 years of marriage. He was in his late 70s, grieving, and had completely shut down. He wasn't eating properly, wasn't sleeping, wasn't engaging with his hobbies. During one consultation, we talked about all aspects of his health, and eventually he admitted he felt guilty about still having sexual thoughts. He felt like he was betraying his wife's memory. I told him something I'm going to tell all of you now. Your sexuality is part of your humanity. It doesn't disappear with age, and it shouldn't be buried with grief. Maintaining your sexual health, even through self-stimulation, is an act of self-care and self-respect. It's telling your body and mind that life continues, that pleasure still has a place, that you're still here. That patient took my words to heart. It took him several months, but he gradually allowed himself to reconnect with that part of himself. A year later, he was sleeping better, his mood had improved dramatically, he'd rejoined his bowls club, and he'd even started dating again. Did self-stimulation cure his grief? Of course not, but it was part of reconnecting with himself as a living, feeling human being. Now, I want to address something that I know bothers some men. Religious or moral concerns. I'm not here to challenge anyone's beliefs, but I will say this. Every major medical body recognizes self-stimulation as a normal, healthy part of human sexuality. The health benefits are documented and real. If your beliefs conflict with this, that's something you need to work through personally or with your spiritual advisor. But from a medical standpoint, I cannot recommend something that would harm you, and I can only recommend things that will help you. And maintaining your sexual health helps you. Let me also address a misconception I hear often. Dr. Caldwell, surely at my age I should be beyond all that. No, you shouldn't. Sexual desire and function can continue well into your 80s and 90s if you maintain your health. The idea that sexual interest should disappear with age is a cultural construct, not a biological reality. Yes, things change. Arousal may take longer. Recovery time increases, but the capacity for pleasure and the health benefits of sexual activity remain. I've worked with men in their 90s who maintained active sex lives, whether with partners or through self-stimulation. They were some of the healthiest, most vital patients I've ever encountered. Sharp minds, strong bodies for their age, positive outlooks. Was their sexual health the only factor? Certainly not. But it was part of the picture, an important piece of their overall well-being. There's one more thing I need to address, and that's technique. I'm going to be clinical here because this matters. Many men stimulate with too much force, too much speed, or in ways that can cause long-term problems. The death grip syndrome, as it's sometimes called, where men train themselves to need very firm pressure to achieve orgasm, can lead to problems with partnered sex and even problems with erectile function. If you're going to maintain your sexual health through self-stimulation, do it properly. Use lubrication every single time. Vary your grip pressure. Keep it gentle. Take your time. Aim for sessions of 15 to 20 minutes, rather than 3 to 5. Focus on the journey, not just the destination. This isn't a race. I've also observed that mental engagement matters. If you're just going through the motions mechanically, you're missing much of the benefit. Engage your mind. Fantasy is healthy and normal at any age. The mental arousal triggers hormonal responses that pure physical stimulation cannot achieve on its own. Now, let me talk about frequency. How often is appropriate? The honest answer is that it varies enormously between individuals. Some men find that 2 or 3 times a week suits them. Others prefer more or less frequent activity. What I tell my patients is this: listen to your body. If you're forcing yourself because you think you should, that's not right. If you're denying yourself because you think you shouldn't, that's not right either. Find what feels natural for you. What I will say is that sporadic activity is less beneficial than regular activity. Your body responds better to consistency. If you go months without any activity, and then suddenly have frequent activity, you're more likely to experience discomfort or problems. Think of it like any form of exercise. Regular, moderate activity is better than occasional, intense activity. I also want to address something that I know concerns many men. What if you're in a relationship, but your partner isn't interested or able? This is more common than you might think, especially in later years. Health issues, medications, changes in desire, or simply different libidos can mean that couples aren't sexually aligned. This doesn't mean you should suffer in silence. Having an honest conversation with your partner about maintaining your sexual health independently can be challenging but necessary. Most partners, when presented with the health benefits, and when reassured that it's about physical maintenance rather than dissatisfaction with them, are understanding. Some are even relieved, particularly if they've been feeling pressure to engage in sexual activity when they don't feel able or interested. Throughout my career, I've learned that men's health issues are often interconnected. When one system fails, others follow. But the reverse is also true. When you maintain one aspect of your health, it supports others. Your sexual health impacts your cardiovascular health, your hormone balance, your mental well-being, your sleep quality, your confidence, even your social engagement. I've seen men transform their entire quality of life by addressing this one aspect they'd been neglecting. Better sleep leads to more energy. Better hormone balance leads to improved mood. Improved mood leads to better social interaction. Better social interaction leads to reduced isolation. It's all connected. Before I close, I want to emphasize something crucial. If you're experiencing problems, erectile difficulties, pain, changes in urination, blood in semen, anything concerning, please see your doctor. Self-stimulation is beneficial for maintaining health, but it's not a substitute for proper medical care when problems arise. Regular checkups, prostate screenings, and open conversations with your GP are essential. What I'm advocating for today is the normalization of sexual health maintenance in older men. We've made progress in talking about mental health, about staying physically active, about eating well. Sexual health needs to be part of that conversation. It's not shameful, it's not inappropriate, it's not something to be embarrassed about. It's part of being human, and it doesn't stop mattering just because you've reached 60 or 70 or 80. Over my 30 years in practice, I've watched societal attitudes shift. We're more open now than we were, but we still have a long way to go, particularly for older men. You deserve to maintain your vitality, your pleasure, and your health in all its aspects. Ignoring your sexual health is like ignoring your dental health or your cardiovascular health. It seems fine until suddenly it isn't. So here's what I want you to take away from this. 1. Sexual health remains important throughout your life. 2. Self-stimulation is a legitimate and beneficial form of sexual health maintenance. 3. Doing it properly matters. Use lubrication. Take your time. Vary your approach. 4. Regular activity is better than sporadic activity. 5. This isn't about morality, it's about physiology. 6. If you have concerns or problems, speak to a doctor. 7. You deserve pleasure and vitality at any age. I hope this conversation has been helpful. I know it's not easy to hear your doctor talk so openly about these matters, but after 30 years, I've learned that honest, direct communication saves lives and improves quality of life. Your sexual health is your health. Treat it with the same care and attention you give to every other aspect of your well-being. Thank you for listening, and remember, it's never too late to start taking better care of yourself.